for today is Halima Mohammed. Halima Mohammed is a certified dental therapist, currently working with Katsina State College of Health Science and Technology, Katsina State, Nigeria. Halima Mohammed is the head of department, Dental Health, currently undergoing a master's program in public health dentistry at the Dafodi International University, Bangladesh. She is a member of Oraposium College of Scholars. She is presenting on ID oral health routine for management of diabetes. Ma, you can proceed with your presentation. Thank you.
Thank you very much. Good morning, everyone. All protocol duly observed. Let me see if I can try share my slide from my own end here. If I cannot, then Mr. Iba, please, will help me share my slide. Thank you.
The slides are being shared already. Your slide is already shared.
All right. Thank you very much.
If you can look at your screen, your slide is already shared.
Okay, thank you. Okay, I can see it. The ID oral health routine for the management of diabetes. I will start by reading out the presentation outline, which include introduction, effects of diabetes on oral health, the risks associated with high blood sugar level, the ideal oral health routine for the diabetics, conclusion and the references. Next slide, please. Introduction. Yes. Diabetes is a lifelong condition that causes a patient's blood sugar level to become too high, and there are two types of diabetes, type 1 and type 2. This type 1 occurs when the body's immune system attacks and destroys the cells that produces insulin, while the type 2 occurs where the body does not produce enough insulin, or the body cells do not even react to insulin. A healthy mouth is important for everyone, but high blood sugar can make it harder to keep the mouth healthy. Diabetics need to learn how to keep their oral health problems and keep a healthy smile on their faces. Taking good care of the mouth is essential to general health and well-being. It even affects self-esteem. Diabetes. Good oral health habits can help prevent pain and infections from teeth and the gums. Yes, thank you. Next slide. So the effects of diabetes on oral health are many generally, but summarized into these following points. Diabetic patients may have less saliva, causing the mouth to feel dry. Dry mouth is also caused by certain diabetic medicines. And number two, the gums may become inflamed and bleed often. These are signs of gum diseases. Number three, infections in the mouth can take longer to heal. Number four, gum diseases may complicate blood sugar management, and poor blood sugar management may precipitate. Yes. So the risks are, next slide. The risks associated with high blood sugar levels include tooth decay, known as cavities, early gum diseases, known as gingivitis, and advanced gum diseases, known as periodontitis, and oral thrush, known as oral candidiasis, and dry mouth, that is xerostomia. So tooth decay cavities, the mouth naturally contains many types of bacteria. When starches and sugars in the food and beverages interact with these bacteria, a sticky film known as plaque forms on the teeth. The acid in the plaques attack the surface of the teeth, that is enamel and dentin, and this can lead to cavities and gum diseases. And the higher the blood sugar level, the greater the supply of sugars and starch and the more acid wearing away the teeth. So for early gum diseases, again, that is gingivitis, diabetes reduce the ability to fight bacteria. So if you don't remove plaque with regular brushing and flossing, it will harden under the gum line into a substance called tartar, that is dental calculus. So the longer the tartar remains on the teeth, the more they irritate the parts of the gum around the base of the teeth, and that is called gingiva. In the meantime, the gums become swollen and bleed easily. This is gingivitis. For advanced periodontitis, if early gingivitis is left untreated, it can lead to a more serious infection called periodontitis, which destroys the soft tissues and bones that support the teeth. And eventually, periodontitis will cause the gums and jawbone to pull away from the teeth, which in turn cause the teeth to loosen and possibly falls out. Periodontitis tends to be more severe among people who have diabetes, because diabetes lowers their ability to resist infection and slows healing. An infection such as periodontitis may also cause the blood sugar level to rise, and which in turn makes diabetes more difficult to control. So preventing and treating periodontitis with regular dental cleanings can help improve blood sugar control. And for thrush, people with diabetes may be more likely to develop dental thrush, which is a fungal infection caused by the yeast Candida albicans. The signs of thrush include painful white or red patches inside the mouth. Practicing good oral hygiene can help to avoid thrush. And for xerostomia, some people with diabetes also experiences lack of saliva, a condition known as dry mouth. So without saliva to keep the mouth moist and bath the teeth, there could be risks of tooth decay and gum diseases and thrush as well. So proper dental care helps prevent damage to the teeth and the gums. So take diabetes and dental care seriously. Next slide, please. Next slide. Yes. So ideal oral health routine for the diabetes management. Number one, make a commitment to manage the condition diabetes. Number two, keep blood sugar level under check to improve periodontal health and support dental treatment. Number three, visit the dental clinic regularly for checkups and for prophylactic treatment. Number four, let your oral caregivers know that you have diabetes. And number five, brush the teeth at least twice a day with fluoride toothpaste. Next slide, please. Next slide. Number six, floss the teeth at least once a day. Number seven, look for early signs of gum diseases. If the gums are red, swollen, or bleed easily, see and report to your oral caregiver. These may be signs of gum diseases. Other signs include dry mouth, loose teeth, and mouth pain. Number eight, don't smoke. Smoking increases the risk of gum diseases and can worsen your diabetes. So briefly, for tooth decay, cavities, and oral thrush, xerostomia, in addition to them, there is what we call diabetes breath. Diabetes breath also causes a lot of bad spreads to diabetes patients. And it is because we already mentioned that rapid bacteria growth is being caused by high blood sugar levels. And the body cells can't get that glucose they need without proper amount of insulin. So the body burns fat instead of instead of ketones. And a lot of them in the urine is being passed out. So when the sugar is being passed out in urine and in the blood, definitely there will be less sugar in the body, and bacteria can fight. Bacteria can get enough starch to feed on, and then definitely they will worsen the diabetes and they will cause this diabetic breast. So by not smoking, removing your dentures at night if you wear them, drinking a lot of water every day, controlling your blood sugar levels, swishing the mouth with mouthwashes, and using tongue scraper, you can reduce this mouth diabetic breast and this slow healing too. Next slide, please. Yes, conclusion. To conclusion, diabetes have a higher risk for oral health problems, and that is the reason why dental care is so important. People with diabetes are more prone to mouth infections. If left unchecked, high glucose level can create an environment where bacteria can grow. This will make it easier to grow plaque, to turn into tetter, and result in gum diseases. To have gum diseases. To have a healthy blood sugar level, you need to practice good oral care, eat a well-balanced diet, and regularly visit the dental clinic. Thank you. References. Yes.